Hey guys, Andrew Lee here, health insurance guy, and I just wanted to make this quick video about why you should enroll into Cover California and why some people don't enroll into Cover California and everything in between. So, Cover California is the state-based exchange where you can get a subsidy based off of your income and your household size and your zip code and your age. And this is all going to be subsidized by the government based off of those criteria. Now, if for any reason you have Cobra, you're self-employed, you're unemployed, you're not offered employer coverage, then you're going to be a great candidate for Cover California because you are probably going to qualify for subsidy because it is based off of income and again your household size. So if your income is going to be lower, if you were offered Cobra and you just lost your job or something like that, then of course Cover California you'd want to gravitate towards. So here's the reason why people should enroll into Cover California because one, you do need some kind of minimum essential coverage, meaning you need some kind of major medical coverage to cover your tax penalty. We have a tax penalty in California now for not having health insurance. And also, Cover California, the exchange itself, now has $0 plans available for people who qualify with their income, right? Based off of their income, household size, age. If they are at a certain level in the federal poverty chart, then they could qualify for a $0 plan if they're within that bracket. But here are some reasons as to, again, why people should enroll into Cover California is because obviously it's comprehensive health coverage, right? Depending on if you're going to go with something as catastrophic as what's called a bronze plan, a silver plan, a gold plan, they all have some kind of stop loss, meaning, God forbid, if you go to the hospital for any reason, you still have some kind of coverage that'll, God forbid, in the situation that you're in, help you take care of whatever the hospital bill is. So let's say you had $1 million hospital bill. The max out of pocket sometimes could be as high as 9,100, but 9,100 beats paying $1 million, God forbid, if you went to the hospital, and that's for the lowest cost plan, right? So of course, having some kind of comprehensive coverage is going to ensure that you are going to be covered at the end of the day if, God forbid, something were to happen. And of course, on top of that, you get free preventative services with that plan, even the lowest cost ones. So another reason why you should get Cover California is because health insurance is financial protection. Yes, of course, it is going to be protection for your health, but also at the end of the day, if God forbid something were to happen, we don't want you to be on the hook for $100,000, right? We want some kind of stop loss and we want you to not pay all that money, and have some kind of coverage no matter what the pricing is, even though it is lower cost. They still will have some kind of stop loss in it. So even if you don't really have to think too much into it, if it's going to be affordable in the bronze or like the catastrophic plans, it's better than having that than nothing, right? Preventative care, like I mentioned, is going to be free. So that's going to be your mammograms, pap smears, yearly physicals, colonoscopies, prostate exams, if qualified, things like that. Those are going to be free once a year. You also get prescription drug coverage, which is if you're taking some kind of generic medication, of course, that's not too expensive, but at the same time, you'd want some kind of coverage for your blood pressure medication, like lisinopril, or if you're, maybe pre-diabetic or diabetic, but taking metformin, things like that. Of course, prescription drug plans are going to come in handy, especially with the specialty medicine and like insulin and things like that. You also do get access to specialists, right? So if you're paying out of pocket for a specialist without insurance, go figure on how much that's going to be. That's hundreds and hundreds and hundreds of dollars. And it doesn't just stop after one visit, it's every time you go. So, of course, having access to specialists is going to be very important. And, of course, emergency services. Like I mentioned, I would always recommend going to the urgent care first because most of the times you can get whatever you need to get done at the urgent care. And then, if worse comes to worse, like 30% of the time, then they'll be like, hey, just go to the emergency room. And so anything emergency, of course, will be covered. So that's another benefit, huge benefit in my opinion. Mental health support, that's a big one these days. So you will get any type of therapy, be it, physical therapy, mental behavioral services, like drug and alcohol treatment, things like that. So if that's something that you needed assistance with, of course, that's going to be embedded into the plans. You also get maternity and pediatric care, right? That's going to be huge. So if you're planning to start a family, a Cover California plan is definitely going to be a good option for that as well too. And of course, again, the legal requirement, you do have to have mandatory coverage for you not to get penalized on your taxes. So Here's another reason why people, or here's more reasons why people do not enroll into Cover California. It's very much, of course, going to be the opposite of what I just talked about. But, from the number one thing that I have seen as to why people don't apply is a combination of complacency and lack of responsibility. And I know that sounds a little bit harsh, but many people don't, they just refuse to take responsibility for their healthcare needs, or sort of try to push it off, and then it turns into a year, snowballs into 3 years, and then all of a sudden something happens, and then they're calling me and saying, hey Andrew, I was in that situation, and can I get health coverage now? So again, just make sure, if especially as we get older too, just make sure that we have some kind of plan in place at the very least, even if it's a bronze policy or something like that. Just at the very least have something in place. And again, people become too complacent about their health coverage, like I mentioned. So they're gonna assume that nothing will go wrong until something goes wrong, right? So you never need it until you actually need it, and that's the kind of mentality some people have. So, if you're there, then it is what it is. But that we definitely want at least some kind of awareness that these plans aren't too expensive at a certain income bracket, and there's always multiple ways to skin a cat when it comes to quoting you. There's also a lot of misinformation out there. I know there's a lot of commercials with all those celebrities on TV saying free this, $0 that. Make sure that you get with the agent that you actually trust, and that's been doing this for a while. I've been doing this for going on 10 years now. So just get with somebody that's going to be real with you, that's going to actually tell you what it actually is going to be, as opposed to finding out for yourself later on that that wasn't the right case. And I get it, misinformation, and that could lead to a lot of problems there. But just if you align yourself with the right agent, then you should be good on that. And one thing that I've noticed also is that why people don't enroll is fear of bureaucracy, right? Just some individuals just hate dealing with the government and bureaucrats, and so for that reason they don't think they miss out on crucial healthcare options, right? So it's just I understand with some people that's the case, but I'm just pointing out why people don't enroll into Cover California that I've seen. And sometimes it's financial overconfidence too, right? Like, hey, some people think that they're their own bank, and they can just they can shell out whichever money that they've had because they've been saving, or they've had a lot of they're pretty well off, and you find out that the hospital bill is insane, like it was a lot more than projected, and all of a sudden we're scrambling for insurance now. So again, I don't want you to be in that situation, and I understand if you have a lot of money saved up, but as a hospital bill, I mean, you can rack up $100,000 just like that, right? And it doesn't stop after one occasion if you don't have coverage. So the last one that I wanted to point out is the assumption of ineligibility, meaning they don't think that they can get coverage now, right? Or they have to wait till open enrollment. There's also special enrollment periods that have I don't know if you guys have seen my posts before, but there's special enrollment periods that happen throughout the year. So if you think that you qualify for one, or want to check that you qualify for one, definitely give me a call at 323-844-8471, so I can go ahead and check where you qualify at, and then realistically go over some of the options with you. And then from there, we're going to customize whatever the usage is going to be, and then from there it's just pretty easy enrollment, and I'll be your agent, right? So that's just sort of how it goes with the pros and cons of why people don't enroll or enroll into a Cover California policy. So I just want to make this quick video for you guys, and thanks for tuning in, and I will see you at the next one. Thank you guys.